Today, we're talking about the dangers of skin cancer and ways that you could prevent it. We are with Dr. Christopher Petsy. He is Division of Surgery Head at Baptist MD Anderson Cancer Center. So thank you for joining us on this important topic.
Thank you, Jordan. It's a pleasure to be here.
Of course. All right. We live in the South, lots of sunshine, of course. Are there ways that we can still prevent it, the skin cancer?
There are many things we can do to lessen our chance of developing skin cancer, and especially serious skin cancers. Skin cancer is the most common cancer in the United States, and it is more common in the southern states. So Florida, Texas, California. So living in Florida, we really need to be aware of the risks of skin cancer and what we can do to lower our chances of getting skin cancer, or we call that prevention. The other thing we can do is early diagnosis, which is going to make these less serious and easier to treat.
I think all of us have heard the word melanoma. It's a scary word, and it's a scary thing to have, probably the most deadliest form of skin cancer. But I mean, can you describe exactly what it is and how it develops?
Sure. Melanoma is the third most common type of skin cancer. That comes after basal cell carcinoma, which is more common, and squamous cell carcinoma. But it is the most serious type in that more people die from melanoma than any other type of skin cancer. Melanoma is a cancer, I tell my patients, it can be a cancer just like any other cancer, just as if someone had a breast cancer or a colon cancer or a lung cancer, and has the potential to spread to lymph nodes and to other parts of the body and to become life-threatening. So preventing melanoma in the first place is important. And if we can't prevent it, the next best thing will be early detection so that it is easier to treat and we have higher success rates.
And so with the development of it, though, I mean, is it only brought on by sun, or, I mean, could you just be predisposed to it and just develop it even without sunshine?
The primary driver of developing malignant melanoma is ultraviolet radiation of the sun, from the sun. So UV radiation, as we call. So the UV index that you hear a lot, even in weather reports and things like that, is really telling us how much radiation we're being exposed to from the sun at any particular time. And that really is the primary driver for mutations of cells in the skin that then turn to melanoma. There are risk factors as well for the development of melanoma, some of which are genetic. I would summarize them as saying that the more fair one's skin is, if you have very fair skin, light-colored eyes, people with red or blonde hair, a lot of freckles, people who sunburn easily, that's the type of skin that you inherit genetically from your parents that has the highest risk of melanoma. But everyone has to be concerned about the risk of skin cancer and melanoma, even those with darker complexions.
We were talking about the risk factors, but are there any warning signs?
Basically, a changing mole, I would say, if I had to sum it up. So if you have a skin lesion or a mole that is growing or changing, if it's multicolored, if it's irregular, certainly if it bleeds, although not all melanomas will bleed, but certainly any bleeding skin lesion, growing skin lesion, if it's enough to get your attention, then it probably needs to be looked at.
All right, well then what are the treatment options? I know there's more than one.
That's true. And the treatment of melanoma really varies by when we find them. So the early stages of melanoma, stage 1 and 2, are treated primarily by surgery alone, basically a wide excision of the melanoma. And in some cases, we remove lymph nodes to test them. The more advanced stages of melanoma, stage 3 and 4, really require a team of specialists to treat. And we've made a lot of advances in the treatment of advanced melanoma in the past 10 years or so. And that's where it becomes especially important to have a team with all of the tools available and all of the specialists available to make a plan for each individual patient.
So if you think you may have this, you definitely want to get checked. So where can they go for more information?
Well, I think your primary doctor, your family doctor is a good place to start. Also a dermatologist. I think if you live in Florida and you have fair skin and you've had a fair amount of sun exposure in your lifetime, I think many people would want to see a dermatologist once a year just for a total body skin examination. Others will see their family doctor, their primary doctor, and can also perform those examinations for patients. But if you have a mole that you're worried about, you need to show it to a physician, a health professional to take a look at it. And a biopsy is such an easy thing to do on that. And it can make all the difference in the world catching these things early as opposed to leaving them there until they're a more advanced stage.
All right, well, let's say someone wants to come into your hospital. Where can they go for more information?
Our website is baptistmdanderson.com, and that's a good place to start. And we would be happy to hear from you and to help you to get that checked.
All right. Well, thank you so much for your information. Hey, this could help save a life.
Thank you very much, Jordan.
Of course. And if you'd like to see this segment again or get more information, go to firstcoastliving.net.